Today's topic is CT scan of air or temporal or mastoid bone. Doctor can advise in any name. You can write in air or temporal bone or mastoid bone. Doctor can advise in either air or temporal bone or mastoid bone. So all the meanings are same. So first let's start with the anatomy. So we have three parts of the brain. There are three parts in air. So one is outer air and this area is the outer air. And then the middle air and this is the middle air and then the inner air. And this part is the inner air. So let's start from the outer air. So we know that the bited structure of the outer air is called outer air. So we know that the bited structure of the outer air is called outer air. So what do we call it? The ear pin. This part is called the folding structure of the skin. And the action inside this is called the concave. And the path inside this concave is called the external acoustic meatus or air canal. And the air canal is above the temporal bone and temporal muscle. And this is the fat and this is the muscle and this is the bone. So what will be inside this canal is called the membrane or the tympanic membrane. Or the air drum, which is the part of the middle air. So from here the middle air has started and the first is the tympanic membrane. So what is inside the tympanic membrane? There are three small bones called the malleus, incus, and stipes. There are three small bones called the malleus, incus, and stipes. So the smallest part of our body is the stipes. This is often called the MCQ. The smallest bone in our body is called stipes. So these are the bones in the air. And this is called the tympanic cavity. The small bones are in the tympanic cavity. Then if we go to the inner air, we will find the vestibule cochlea. This is the cochlea. And it looks like a snake. It looks like a snail. And on top of this, there are three round structure, semicircular canals. And from this cochlea, two snakes have come out of the vestibule cochlea. One is the vestibule snake and the other is the cochlea snake. And here is another canal, the eustachian tube. This is a canal. This is the inner air. These are the canal's bones, incus, stipes and malleus. These are the smallest bones in our body. And this is the cochlea. This is the vestibular system. And vestibular nerve goes to vestibular system and cochlea nerve goes to cochlea. And also it is called auditory nerve. And this is the air drum. And the second image is the clear one. This is the cochlea. And this is the semicircular canal. And this is the tympanic membrane. And these are the smallest bones of the air. And this is the nerve, cochlea nerve. So now the patient positioning. The patient will lie on the table with your head first in a head pressed and chin slightly elevated. As like brain positioning. We will position the head like CT scan brain. And the chin should be depressed downwards. And soft cushions will be placed next to your ears and head will be lightly strapped in over patient's forehead. We will place foam on both sides of the ear and we will place a strap on the head without any tension. Now the scanning protocol. First we will take a topogram. And this is a lateral image. And this is MA35, KV 120, and slice thickness 0.6 mm. Topogram length is 256 cm. And the scan direction will be the canal caudal. So canal caudal means head to foot. So scan starts from the vertex to the neck. So the centering will be over the head. Now we will give the plan of the canal protocol. Plan on topogram to scan from the top of the ear to the base of the skull including the mastoid. So we will take the scan of the canal. The scan will be from the top of the ear to the base of the skull. And the scan direction will be the caudal canal. So the scan will start from the base of the skull and the scan will end at the top of the ear. So caudal canal means the scan starts from the foot level. That means the base of the skull to upper ear. Now we will reconstruct the canal. So as we get the axial image, then we plan the reconstruction slices separately. One for right ear and one for left ear. The reconstruction protocol size thickness will be 0.6 mm and increment 0.4 mm. Reconstruction will be first axial and the canal is ultra 90, ultra sharp. So that is the canal means the window. And the window is inner ear. The window is another thing. So the reconstruction will be done in the inner ear. And this window will have a characteristic. Now the reconstruction will be done in the right ear. We will reconstruct the right ear separately. This is reconstruction 1. And we will reconstruct the left ear separately, so that the field of view will be less. We have set this field of view, so all the corals will be in the right ear. An axial reconstruction of right ear for copular implant. A localized axial reconstruction of only the right ear is done using the same parameter as reconstruction 1. But the corals must be changed to ultra 70, ultra sharp. If we have copular implant, we will reconstruct another one. We will change the corals to ultra 70, ultra sharp. There is an option called corals in the reconstruction software. We will reconstruct the corals to ultra 70, ultra sharp. Similarly, we will reconstruct the left ear for copular implant. And the kernel of this will be U70 sharp. Reconstruction jobs 1, 2, and 3 are loaded into 3D. We will load the reconstruction jobs one by one in 3D. And reconstruction jobs 4 and 5 are loaded into InSpace. And we will load the reconstruction jobs 4 and 5 for copular implant. If we have an application called InSpace, we will load it. Now we will make the films. This is the first film of air. We will show you 2 ears with an axial 1 mm. This is both air. Axial 1 mm both air. And the next image is coronal 1 mm both air. We will make the coronal image from the first reconstruction. After making the images, we will come to the film. These images are created from our first reconstruction images. Then we will print the right air with an axial 1 mm. Only the right air film is this. We will come to the right air image in this film and we will zoom in. This is the right air with an axial. And next is the left air with an axial. We will print the left air with an axial. These are the 2D images. If we can make 3D images in CT scan, we have InSpace software. InSpace software is in Siemens. If you want to create 3D images of the vestibule cochlear in CT scan, then you have to use this InSpace. Now we will see the CT scan. This film is not clear. Now we will see the CT scan. This film is not clear. Here we can see the cochlear. These are the cochlear. And the bones. The small bones of the body are malleus and incus. This is the mastoid air cell. This is the internal artery metas. In this film we will see the stipes, malleus and incus. This is the mastoid air cell. This is the posterior semicircular canal. This is the malleus head. This part is the malleus head. Next is the incus body. This is the vestibule. This is the facial nerve, horizontal part. Next image is the vestibule. This is the lateral semicircular canal. These images are new from our net. The resolution of these images is very low. These images will be of higher resolution. This is the superior circular canal. This is the posterior semicircular canal. This is the epithem. This is the malleus head. Next image is the coronal image. The coronal image is shown here. The whole bone is shown vertically. In this coronal image we can see the coronal image. This is the corneal image. This is a cochlea. These are the bones of the canal. This is the malleus head. This is the air drum.